The impact and aid of artificial intelligence in the medical field and research. By yours truly, Ariyan Ashrafian, a student of LTEC 4121. Let's begin with a little bit of background on artificial intelligence. AI is a computer-generated system, or a GPU, that performs tasks which typically require human intelligence. These could be looking over data, reading patient diagnosis. There's so many options that AI can do which help with better error treatment and as well as speed. In medical context, AI can assist in predictive diagnosis especially. We'll dive into that deeper, but data analysis is another one, and personalized treatments for specific targets. Growing integration of artificial intelligence within healthcare has transformed both patient outcomes and medical research, as we will see later on in the slides. A small bit of historical background. AI actually's introduction was back in 1970 with a machine called the Mycin, which used to take vast majorities of data, read it, and give a small little summary. Advances in the late 2000s have also seen accelerated adaptation of AI, especially in deeper learning programs, which focus on simplifying harsher-to-do tasks. Lately, patient screening and pregnancy predictions has also been common within family physician and OB-GYNs in early detection and vast patient data analysis. So we're going to take a small little break from the medicine part and let's deeper dive into what artificial intelligence really is about. So I have an icebreaker here of two different types of pictures of both the actor Will Smith. If you know anything about AI, these images were circulating around the internet very early, but two of these images, one of them is AI, the other is not. And I have my younger brother here who is clicking the slides to tell us which one he thinks is AI.
Number 2.
So he thinks number 2. I would think so too. I really hope number 2 is AI. But in actuality, both of these images are artificially intelligent. All right. This one was generated by myself using a different program, and this one I found on the internet because it's funny. But both of these images were artificially intelligent and AI generated. Just shows how different and how vast it is accelerating in the smarts and ability to do things. So how can we apply this into diagnosis? In places like radiology, we see many readings with different types of diseases and imagery on there. And AI is able to accurately interpret those images to give better analysis. Deep neural networks like X-rays, CT scans, MRIs are all supported and assisted and elevated through artificial intelligence. The application of AI lessens our error and are especially in diagnostics and unforeseen abnormalities. AI's pathology and laboratory use is also one thing to be known. AI's algorithms and systems allow for pathological slides in cancer research and cell detections, as well as automotive and repetitive tasks which require long and tedious work to be done in quick seconds by a GPU. Diagnostic variabilities and early detections is a crucial asset when using artificial intelligence, as it provides that vast data knowledge. So where can we see this? Predictive analysis is one very used AI assistance. Predictive models identify patients at risk for certain conditions as sepsis or even cardiac arrest. Machine learning analysis uses real-time patient data and enables proactive intervention and improved patient outcomes. We can also scan and review vast data sheets and information to see trends of abnormalities, to be able to catch them before they are even seen. This is a small little infographic about the physicians, the medical school, the residency, and the fellowship. Everything that a usual physician needs to become a practicing MD. And we see the artificial intelligence has more than just that, and much more knowledge that is able to be used in practice. So we're going to get into a small little outskirt of AI. It's called NLP, Natural Language Processing for Healthcare. It allows computers to read, scan, and interpret all of these critical notes that these physicians and doctors are making. Extracts these relevant informations and then the text into electronic health records. And this NLP is connected into the AI as it improves our document efficiency and enhancement of research and data qualities. So how does this work into medical research? We've seen the pathology, we've seen data analysis, we've seen predictive analysis. But in research, we find accelerated drug discoveries, finding cures to certain drugs that we never even knew about. Through trends and vast data analysis, we are able to see modeling and molecular simulations, which actually can predict things that we've never even noticed. Recent AI literature reviews have identified relevant studies for meta-analysis as another further preventive and defining AI tool. Here we have a list of beneficial procedures for AI assistance. It increases our diagnostic accuracy, maybe reduces human workload and burnout, as our physicians and our nurses go through too many hours and too many struggling nights where they are reviewing paperwork upon paperwork, and an AI or GPU system which could read all of this data and give them a small clip note summary could help with the burnouts, with the time wasted, and with the amount of doctors that we are lost to the vast paperwork. AI also assists in enhancing patient safety and treatment quality by being able to research and look over these vast data sheets, not just them and their family, but everyone around them. We get quicker and faster diagnosis, especially from a physician standpoint. Having an AI that listens in on the patient interaction and writes down everything needed to know, takes that information, puts it into a data, and comes out with possible outcomes or abnormalities that may cause differences in that health of that patient. AI can also improve accessibility in remote and underserved regions, especially third-party countries which have less internet or access to medical field. AI could go over there without a human person there, but an AI-powered doctor to save and help rehabilitate those third world countries. There are so much more AI can do. With just the implementation in the last couple of years, it's only up from here. So what are the challenge and limitations? If we refer back to our little icebreaker, we notice that AI can sometimes mess up. How does this limit AI into our predictive analysis in our medical field? Well, the data collection comes with privacy and very, very crucial patient information. Information that cannot be given out or released to the public. AI is very blind to bias. It does not understand who you are as a human, only reads your data. So there is a lot of bias due to skew in data sets whenever it comes to artificial intelligence. There's a lack of transparency or empathy with AI. It is a GPU, a computer. It can be quite costly. While AI may be free for you with ChatGPT, a reliable private source could be very hard for medical fields, especially with private patient confidentiality papers, to have a specific and correct program. And lastly, misinformation. Will Smith doesn't look like that. However, AI takes data from a lot of things. Maybe people who don't look like Will Smith, but have the name Will Smith. AI is a balance. We need to find it to help us use and accurately help our medical field. Going further into this, the ethical considerations and factors which are informed consultant and data diving of ownership needs to be maintained. The confidentiality is of top tier when it comes to increasing AI independence. Accountability for AI-driven errors. Who is responsible for the computer-generated mistake? Ethical AI frameworks. How we build around the fairness and accountability of this transparency. And lastly, going back to that blindness of ethics and culture. AI is not able to see us. It is blind to who we look like. It only has the data we are given. To go into a more lighter note, let's look at a case study, the early detection. Take into account a basic AI model. For the example we'll be using is Google's AI Copilot, which I've actually found very useful, versus a team of human radiologists. This study was done in 2024 by healthit.gov. The AI model would achieve a 94% accuracy for breast cancer detection in the ability for its detection of all these women, while our human radiologist team would score a mostly 88% accuracy for the same identifying cancer patients. What does this mean? The case study I just showed you informed you that AI is extremely smart. It is a mixture of the best scientists you could put together and the internet. It's just too powerful. So then why don't we use it more? Because of the ethical, the blindness, the accountability. There are so many factors that you need to take into consideration before taking artificial intelligence by the hand. So how does that work in the future of artificial intelligence in medicine? Integration of portable and wearable devices like IoTs, which would go home with patients with an AI built in to detect outcomes of when a patient might go into cardiac arrest, a heart attack, or even more. The patient can then get sent to their doctor a in-time, real-time notification sent by the AI to inform the doctor of what needs to be happening next. This allows for continuous moderation of certain patients, especially with ones who cannot afford staying in the hospital. We see adaptations of these data sets, although they are blind. Enhancement of telemedicine and predictive analytics to aid family physicians and other medical fields, and especially early detection with our cancer screenings, pregnancy screenings, every type of screenings. AI is able to benefit by using data sets to then smallerize that population and give us better results. Before we get into a conclusion, if we go back a couple of slides, we have been seeing this little AI picture in this corner. You haven't noticed it because I haven't pointed it out, but that is also another AI-generated medical field that has just been put in there under your nose. So how does this work out? How does AI help us in the future? It is all about balance. Being able to balance the limitations that AI has, the mess-ups, the correctness, the efficiency, all of it. Finding the balance between real and GPU is the point. Artificial intelligence can transform any area of the healthcare field. It is extremely powerful. The key is to improve its efficiency, its accuracy, and how we control it. Everybody was given a pamphlet. By everyone, I mean my younger brother. Inside of the pamphlet, we were given the impact of the artificial intelligence in the medical field. Another AI-generated image, by the way. This goes over the reference to the computer-based systems and capabilities, as well as a predictive AI analysis in the hospitals that were based in 2024. We see here that almost 80% of AI was used in EHR-sourced hospitals, 50% used their own in-house AI models, and 52% used third-party AI models like Copilot or ChatGPT. While it might be scary to say the least, from a very bad-looking Will Smith to the scary accuracy that AI has, it's going to be okay. We've survived many different revolutionaries, especially technology. It is only time for humans to adapt and overcome. With that being said, I could answer any questions about what we had. Do you have any questions? That's a great question. How could AI help me at home? Well, as it might not be recommended by most medical professionals, AI already is being used in your home. Every time you look up something, maybe have a rash on your head, you look up ChatGPT or an AI to assist you. So maybe a government-provided medical facility or program which could give real in-time responses that are generated through artificial intelligence. Any other questions? That's another great question. If we use AI in research, couldn't there be errors? The errors is where we come in. Being able to identify the information that AI gives us and then explicitly cutting out the incorrect information or the extremely skewed information. Any last questions? You're on a roll. Wow, that is a really good question. I did just use Google Copilot to make all of these AI-generated images. That's how easy it has become to use simple AI-generated stuff. Thank you so much for listening to my AI story and how artificial intelligence is being implemented into your medical field as we speak. It's only a matter of time before all of us are replaced. I'm just messing with you. Thank you so much for watching.